Okay, let's go with the next one. Acne. Acne, it's not like we haven't done previously. We have done it previously as well, but this scenario is a bit interesting. Let's see what I want to add in this. You're after in GP surgery. Your patient is a young male, 28, complaining of acne. Talk to him, assess, and do the management. I've been getting a lot of acne recently, and I want to get rid of it. Okay, fine. So do Odipara a bit more, right? And acne is a kind of rash, isn't it? So you know how to elaborate a rash. So you try doing that. For how long you've been having it? Is it the same? Is it getting worse? What you need to ask is it only on the face or any other part of the body? Like on the chest and all, on the neck area, if it is there or not. So that is really, really important. So patient has got acne. You can also ask, uh, what have you tried so far? That's very important as well. Okay. Another thing is a young male. So during the history, when you ask the patient if you're taking any supplements, this and that, this patient will say, I've been taking some bodybuilding supplements as well, and I'm taking a medicine known as D. He won't name it. He's just saying it's D-di. He didn't name it. So what we believe it was most probably Dynabol. He's taking something, he's going to the gym, he's a bodybuilder, and he's taking a supplement. I don't know the exact name, but it is something from D. Something starts from D. When I asked, do you have the medication with you? He didn't give the medication to anybody. But most probably what we think it is Dynabol. Now the thing is, when he says that I'm taking these medication, you need to ask, are you taking it as prescribed? Meaning, I want to know if somebody has prescribed this person or not. Is it supervised drug or is he taking it illegally, illicit drug? Because in the UK, it's not available. Nobody's prescribing it. Nobody's giving it. It's not available in the UK. But yes, a lot of people, they're taking it illegally. Right. So if it is taking as a supervised drug or if it is taking it illegally. So that is very important. And I don't want you to miss that point. Right. So patient has got acne, elaborate the acne a bit more, like for how long you've been having it, anything makes it worse, anything makes it better. Is it only on face or is it anywhere else in the body? And have you done something so far for your acne or not? Right. When you've got acne for a very long time, it actually leads to your low mood and depression as well. So I want you to do quick screening for that as well. Right. And this patient is a bodybuilder. So you will ask about if he's taking any supplements. Yes, I'm taking. Is it supervised or if it is illicit drug if he's taking? So that is going to be very, very important. Dynabol, when you take it, it's not supervised, obviously. So one of the side effect is acne. That is the thing we are looking for, right? So what you're going to do, you're going to do some blood test. That is hormonal level you will check. And obviously you will check for the rash as well. They will show you a picture, which is actually a mild acne you have got. Fine. So then you can tell the patient that what we understood is you might be having this steroid-induced acne. Yeah. So it's common people using these steroid like Dynabol. So acne occurs when the hair follicles in your skin becomes blocked with oil and the dead skin cells. Yeah. So that is the main thing. In your case, anabolic steroid can increase oil production, leading to clogged spores, causing thickening of the skin, trapping bacteria inside, promoting inflammation, leading to the acne. That's what you can say. Now, what you need to do, you need to do some blood test as well. Blood tests are very important liver function test because this anabolic steroid, Danabol, can affect your liver. So first thing I definitely want to do is the liver function test. And as you're taking anabolic steroids, I have to go for hormonal level as well. So the testosterone or LHFSH level we need to do for females. And lipid profile can also be done here. Right. Now, what is the treatment? Treatment is simple. You have to stop steroid. See, it's not only anabolic steroid, even other steroid like prednisolone can also give rise to it. So what happens is, if, for example, if I forget about anabolic steroid, but my patient is taking prednisolone for something else, I cannot stop it, but I try to review the medication, I try to taper it down. But here my patient is taking anabolic steroid, so I can definitely tell the patient to stop it because that is the reason of your acne, right? And wash your face twice daily. Don't wash this too many times. Yeah. Avoid touching the acne, shower after workout, avoid greasy skincare products as well. The medical options that you can offer. See, whenever we offer something in acne, we give a combination of it. Usually for mild acne, what we give, uh, for mild is benzoyl peroxide and topical retinoids. Adapalene, tretinoin, that's something that can be given. And also you can add maybe topical antibiotics as well, right? So it's topical thing that's given. And don't give only one thing, it's a combination that's given. So benzoyl peroxide or maybe topical retinoid, a topical solution you give. Sometimes we can go for topical antibiotics as well. That's for mild acne. If it is moderate, the management is still the same. But if it is moderate to severe, you know what we can do? We might be able to add oral antibiotics. That's the difference only. So if it is moderate to severe, if it is mild to moderate, you just go for topical thing. But if it is moderate to severe, we may be going for oral antibiotics as well. But if it is very severe acne, you may be able to go for isotretinoin as well. But this is very strong medication. It has got so many side effects as well. It can affect your liver, your kidneys, and it's going to make your skin very rough as well. You can have hallucination, psychosis, lots of side effects are there. So you are nobody to start the patient on isotretinoin. It has to be started by the specialist only. And we don't give isotretinoin or Roaccutane straight away, even in severe acne. For severe acne, we again try to go for topical treatment first. We can go for oral antibiotics, but topical treatment. But if that's not working at all, symptoms are getting worse, then maybe the specialist might start the patient on isotretinoin. So I don't want you to mention it actually, just forget about it. Right? So follow-up is going to be, first I'm going to give topical treatment, but if that's not working, we may consider giving you oral antibiotics as well. But make sure you tell the patient to stop anabolic steroid. Right? And if you get these things in the exam, just check it, because your patient, as I said, may not be saying Dynabol. I'm taking a steroid, it is start from DDD. So you can confirm, do you mean Dynabol? So I think that will make your life easy. So that is your acne, steroid or Dynabol induced. All right.